Going back to exercise for a minute, it may seem almost an impossible task for somebody if they're short of breath, just getting up and walking around their house to actually exercise. Are there some best practice principles out there for people who do want to exercise, or should people exercise at all with oxygen therapy?
Absolutely, they should. They don't get a pass. So, and it's actually even more important, but you're exactly right. Patients will look at me and say, how could I possibly exercise? When I get up to walk to the kitchen, I'm gasping for breath. And I can understand the feeling of how could I possibly exercise? But exercise is a very unique non-drug treatment that's critical for patients with chronic lung disease. And the best form, of course, is pulmonary rehab, which we can talk about in more detail. But it's very important to keep moving and keep mobile for many reasons. The first reason for exercise is that it will actually, over time, it can decrease your sensation of breathlessness. It's so if you are repeatedly exposing yourself to being a little short of breath, and of course, the ideal situation is with a person coaching you on some breathing techniques, monitoring you, so giving you the confidence and the reassurance that you continue to do that. And over time, you can actually not only build endurance, perhaps being able to walk more on your 6-minute walk or walk more at home and without being as short of breath, but it also can decrease the sensation of breathlessness. And it's a little bit of everything. You can decrease the anxiety around getting short of breath, which is critical because when you're more anxious, you tend to use your respiratory muscles, breathe more rapidly, and you become more short of breath. So coping with the anxiety, doing muscle training, so aerobic and training over time for any of us allows us to do more with less breathlessness. And the muscle toning is critical. We need you to also involve flexibility, stretching, and weight training, strengthening. So specific weight training. So 3 pieces go into the exercise: the stretching, the strengthening, and the aerobic part. So it's critical. There's a great deal of evidence, that the less you do, the more deconditioned you become. And we have patients that will come in to see us, and their deconditioning is more of a problem than their pulmonary function numbers per se.
Oh, wow.
Than their lung function. So we know that their deconditioning is from being sedentary, not from their pulmonary function testing, or maybe they're both involved. But we know we can change your physical conditioning. It won't change the numbers on your breathing test. So it's important for patients to understand. But it can, regular paced exercise can decrease your shortness of breath over time and allow you to do more. And it helps, mood, anxiety, but it's tough to start. And there's many options for that, which I think we're going to talk about. Is that correct with pulmonary rehab? Because
Yes.
there are many options for patients now, but exercise is important.